Xanax can stop a panic attack in about 20 minutes. For some people, it is the right medication, especially if used short term. But the same speed that makes it work can make your anxiety come back worse a few hours later. I'm Dr. Ayer, quadruple board certified psychiatrist, and I've treated thousands of people struggling with anxiety. If you've taken Xanax and felt calm, then felt worse a few hours later, then reached for another one, you're not alone. What you felt has a name and a mechanism. Let me start with where this drug came from. Alprazolam, the real name for Xanax, was created at the Upjohn Company by a chemist named Jackson Hester, and it reached the market in 1981. It belongs to a family of calming drugs called benzodiazepines, and it quickly became the most prescribed one in the country. It was built for one thing above all else: speed. It does something other anxiety medications don't do. It works fast. Within a few years, it was everywhere, on magazine covers, a household name. And the whole reason came down to that one quality. When you're terrified, speed sells. Here's why it works so fast. Your brain has a natural brake pedal called GABA. GABA is the chemical that tells your racing thoughts and pounding heart to slow down. Xanax presses that brake pedal hard, and it presses it almost right away, reaching its peak in your blood quite quickly. That is why it can pull you out of a panic spiral so quickly. But here's where it gets interesting. Xanax is a short-acting drug. Doctors measure this with something called a half-life, which is how long it takes your body to clear out half a dose. For Xanax, that is only around 11 hours, and the calm you feel fades much faster than that. So the brake you pressed starts lifting while the day is still going. Let's briefly talk about Gail. Gail is in her early 50s. She was put on Xanax for panic attacks, and at first, it was a lifesaver. But within a few weeks, she noticed something strange. She would wake up at 4 in the morning with her heart racing, worse than before she ever started. She thought she was falling apart. She was not. She was feeling the drug wear off between doses. And this is the part that surprises my patients the most. That between dose anxiety is not Gail's imagination, and it is not a sign her anxiety is getting worse on its own. It is printed right on the official FDA label for this drug. The label says early morning anxiety and anxiety between doses have been reported because the calm wears off before the next dose is due. Her nervous system was not broken. The medicine simply wore off early. Now, this next piece changes everything. When Xanax leads, it does not just stop working. It can swing your system the other way. This is because beyond its calming effect, Alprazolam suppresses the body's stress response systems, including the HPA axis, which governs cortisol release. It does this indirectly by enhancing GABA, the brain calming chemical. This reduces stress hormones like cortisol and adrenaline. When the drug clears, particularly after regular use, these suppressed systems can rebound and overshoot. This can lead to withdrawal symptoms such as heightened anxiety, rapid heart rate, elevated blood pressure, and in severe cases, seizures. So the alarm does not just come back. It can come back louder than where you started. Picture pushing a swing down hard and letting go. It flies back higher than where it began. This is why the 4 a.m. panic can feel worse than the panic you took the pill for. And here's what nobody tells anxious patients. Every time that happens, your brain learns a lesson. It learns that the pill brings relief and the gap brings dread. So you reach for it sooner. That is not weakness, and it is not a character flaw. That is your brain adapting to a fast drug the way a fast drug trains it to. This is how tolerance and dependence quietly begin, even in people who follow every instruction. A pill can quiet the alarm. It cannot retrain the nervous system that keeps setting it off. That retraining is the real work, and it is exactly what my program, the Nervous System Reset, was built to do. If you want the deeper roadmap, the link is in the description below. Now, before I go on, I'm not discounting the fact that Xanax has been a game changer for some of you. For sudden panic, for a one-time crisis, this drug can be the right call, and I prescribe benzodiazepines myself. I'm not here to shame anyone or tell you to stop anything. I'm here to explain the mechanism so you can make better decisions with your own doctor. So let me tell you how I use this drug with my patients. When I reach for a benzodiazepine at all, I keep it short, usually less than 3 weeks, because that is where the benefit is clearest and the risk is lowest. And when one is truly needed for longer, I lean toward a longer acting option like clonazepam because it has a longer half-life. That means far less of the between dose rebound we just saw with Gail. In my practice, the people who struggle most were left on it for months, not weeks. There are other reasons I'm careful with this medication. As we age, these medications get riskier to take. They raise the odds of falling, and falls later in life are linked to earlier death. The research is pretty striking. Studies suggest that these drugs can raise the risk of breaking a hip by anywhere from about a third to half. And for people who are new to them or currently taking them, that risk can climb even higher, in some cases doubling. The risk of falling in the first place goes up to by roughly 40 to 80% depending on the drug and how long someone has been on it. So why does this happen? It comes down to what these medications do to the body. They slow your reaction time. They mess with your balance and steadiness on your feet. They make you drowsy. They can leave you feeling unsteady, almost tipsy, even when you have not had a drop to drink. They also dull the sharpness of your mind, especially your attention and your sense of where your body is in space. And they can drop your blood pressure when you stand up too quickly, making you feel dizzy. Put all of that together and you have a recipe for a fall. I'm not telling you to stop anything. That decision is always one to make with your prescriber, never on your own and never because of a video. But if you're older or you love someone who is, this is a conversation worth having. There is also a long-running worry about memory and dementia. These drugs clearly contribute to brain fog and poor focus while you're on them, and these improve when you stop. The long-term dementia question is still unsettled, partly because anxiety and poor sleep can be early signs of memory trouble themselves, which muddies the picture. And this is the one rule you must always remember. Never stop a benzodiazepine suddenly on your own. Stopping cold turkey can trigger seizures, which can be life-threatening, and the danger is greatest in the first few days. Now, for some of you, medication will always be part of the picture, and that is not a failure. Some nervous systems need more support for a while, and there is no shame in that at all. The goal is not necessarily zero medication. The goal is understanding what you take and why, and also minimizing the doses and number of medications you take. Your nervous system can be calmed and retrained. You're not stuck. Gail is proof. For months, she believed she was the problem, weak for needing it and broken for feeling worse. But she stopped blaming herself, worked with her doctor, and slowly built a nervous system that could hold itself steady without needing rescue every few hours. So here's what I want you to sit with before you take that next pill. Xanax can quiet the alarm. You have seen why it can. Also make that alarm ring louder. But quieting an alarm and asking why it keeps going off are two different things. This is exactly what the next video focuses on.